I'm chairman of the Orleans County Legislature. We want to thank our unsung heroes today who are trying their best to get us through these difficult times. Their work at risk to their own health is vital to our communities. A huge shout out to all of the healthcare workers, law enforcement, first responders, and volunteers especially on the front lines of this coronavirus epidemic. We thank you. At this point in time, I'll bring our Public Health Director, Paul Pettit, to the forefront to give the update for today. Paul?
Thank you, Madam Chairman, and good afternoon, everybody. So this is obviously is a new format we went to where we're not providing daily updates where we were a week ago. Again, we appreciate everybody's consideration around there, knowing that it takes a lot of time to prepare all this information. And as we said from day one, our goal is to keep you all informed, to make sure that you have the most vital and accurate information that we can provide, and to make sure that you guys are all staying safe. Again, our goal here at the health department and the county government is to make decisions to make sure that we're doing everything we can to keep everyone safe during these unprecedented times. So with that, I'm going to spend a little bit of time going through situational update, talking about what's going on locally in our communities with some updated numbers. And I do know that we have Dan Ireland, who's the president of UMMC down in Genesee. He's going to provide an update on some of the activities over at that campus. And then obviously we'll be able to open it up for questions to the media at that point for any decisions to make sure that the clarification and that we can provide answers. So again, as I get started here, I just want to again thank everybody for their continued work and continued collaboration and efforts that everyone is doing. As Lynn has mentioned, these are unprecedented times, and you know, from the health department side, the efforts that everyone is taking, the extreme social distancing that's occurring, and just the overall community support and work around this, it's been amazing. We've seen many countless examples of people coming together, neighbors helping neighbors, and it's truly wonderful to see us coming together during these difficult times. And we appreciate that, and we know as we move forward that continuing to do this, and especially in the near term, is essential for us to be able to continue to flatten the curve and slow down the spread of this virus. And we do know, and we have seen that it is working. Cases and numbers, as we'll relay a little bit today, are not as high potentially as they were in other areas that were not as quick to maybe put in some of these social distancing measures. And you know, we're hopeful that'll continue to help us as we move forward. So as of today, again, we set 2 o'clock as our deadline as far as gathering information for these updates, mainly since it is very fluid and updates, new cases, et cetera, can come in literally by the minute. So currently, Genesee County has received 3 new positive cases of COVID-19 for a total of 7 cases to date here in Genesee County. Quickly on those cases, one of them was over the age of 65 and resides in the central part of the county. Another one, again, over the age of 65, residing in the central part of the county. And one person under the age of 65 residing in the western part of Genesee County. Currently, out of the 7 positive cases in Genesee County, under mandatory isolation, 3 of them are in the hospital, all here locally in UMMC. None of the cases that we just announced today, so none of the new cases, were under precautionary or mandatory quarantine prior to becoming symptomatic, and they are not believed to be connected at this point. Again, the investigations are ongoing. We continue to do case contacting, but at the moment, we have not found any connection back to any of the confirmed positives that we have had. For Orleans County, there were no new positives today, so we're still at 4 cases where we were yesterday. Again, contact tracing, just to talk about that a little bit, you know, our nurses and our epidemiological folks, they're essentially following these cases backwards. And for the purposes of COVID-19 investigations, again, due to the increasing numbers and the work and time demands to look backwards, the state has recommended we only go back to when symptoms began. So, you know, when we do identify a positive, we're only looking backwards to when those began. We're not going back 14 days, potentially through that incubation period, and seeing potentially, you know, who they may have come in contact with. So again, that's a little bit of the process as we move forward and how we're doing those case contacting investigations. A little bit of cumulative data to date. Again, we're trying to keep a running total of some other vital information that we want to make sure folks have access to. And Genesee County has received 75 negative tests, and Orleans County has received 74 tests. As you can see, compared to yesterday, I think there's about another 14 or 15 tests that we got back results on. So again, there is the beginning of flow as far as testing from the laboratories. And, you know, one thing I do want to note, as we've been talking about, is flu. We continue to see that flu is prevalent in our communities. And in the week ending March 14th, in Orleans County, there were 8 confirmed flu cases and 22 confirmed in Genesee County. So this, based on the number of negatives that we're seeing, is very indicative that there still are other respiratory illnesses circulating in our community. The strong majority of COVID-19 tests are negative for COVID-19, again, assuming that they could be flu or some other respiratory illness. So it is important that as we move along, that if you know, you see people with respiratory illness, if you have that, again, that's an indicator, but it's not necessarily positive for COVID-19. It could be another issue. But regardless, we want folks to stay home and isolate and not be out and about in the community. These are good practices, whether we're dealing with obviously a novel virus like this or typical seasonal flu. So Orleans County, again, just some additional data. 6 people are under precautionary quarantine, 8 people are under mandatory quarantine, and 4 people are under mandatory isolation. 1 of them who is hospitalized, and 3 are recovering at home. And as we reported yesterday, 1 of those is isolated in an adjacent county. For Genesee County, 17 people are under precautionary quarantine, 34 are under mandatory quarantine, and 4 people are recovering under mandatory isolation at home, and 3, as I mentioned, are under mandatory isolation in the hospital. Again, you know, healthcare workers is, you know, an area where we're encouraging folks to go first. We want you to call your primary care physician first when you may become symptomatic. Talk to them. A lot of them are starting to get some swabbing kits, again, depending on the healthcare affiliations they may have. So the first place we want folks to go is to call their healthcare provider, touch base with them. Do not show up there. Do not show up at the emergency rooms, etc., and go into those facilities if you have respiratory illness. Again, we want to protect our healthcare workers, our first line of defense. So it's very important that we touch base on the front end and make sure we're not unintentionally exposing them and showing up without them knowing. A little bit on clearance sampling again. So as we have folks that are starting to reach the end of their 14-day quarantines or 14-day isolation periods, you know, there is guidance by the state that we do follow for clearing samples, clearing folks that may be COVID positive. And currently, the guidance is that it has to be a minimum of at least 7 days from the onset of initial testing. So when they got their test results back, so there's a minimum time period there, 7 days. They have to be at least 3 days without fever, and again, without any fever-reducing medication. And currently, they have to have 2 negative COVID-19 swabs 24 hours apart. So to get someone out of isolation that is tested positive, there is a process. They can't just, after a certain time period, go back out into the community at the moment. There is swabbing that has come back negative. And again, we're monitoring those folks in their homes throughout that period with daily checks in person and also a secondary check with a phone call and touching base with them, monitoring temperature and symptoms. So again, you know, we do want to remind folks to remain home if you're ill. Again, you're hearing this a lot out of myself during these briefings and also out of the different presses that we put out. But it is very important that folks adhere to and follow the social distancing requirements and recommendations that are out there. And, you know, this is extremely important to protect those that are most vulnerable that are dealing with this, and that's our seniors above age 65 and anybody else that's immune compromised or dealing with other underlying health issues. Very important to protect them and make sure that we're adhering to the different guidance that's out there. You know, part of that's about respect, right, and social responsibility. And, you know, it's one of those things we want to make sure that folks are really sensitive to those facts. I mean, there's a lot of anxiety and concern by people out here, you know, in the community. We get the calls every day. Folks are just very anxious and uncertain, and we need to be respectful and make sure that we're, you know, doing our best to, you know, understand where those folks are coming from and making sure that we're doing our best to protect others by protecting ourselves, and that means adhering to the guidance that's out there. You know, we're 2 smaller counties, right? We're small, but we're mighty. And it's kind of that old adage, everybody knows your name a lot in our communities. And it's very important that we're looking out for one another. And, you know, when we do provide information around positive cases and quarantines. I know there's frustration and some angst by folks that we're not sharing more detail. And we literally are not allowed to do that. I mean, HIPAA is in place, health privacy laws are there, and we need to make sure we're doing our best to protect those that have tested positive or maybe dealing with any health illness, whether it's COVID-19 or something else. So I know it's frustrating, but I want folks to know that we are doing the case contacting, we are going and identifying folks that have been in close contact, and those people are being placed under mandatory quarantine. There may be situations, and I know people have seen it on the news, where they may say, so-and-so has been to Tops or Walmart or the mall at a certain time in a certain period. We would do that if it required. All right. So what we're doing is, depending on the case, we're actually looking and trying to, again, figure out their contacts. And if there are situations where this person may have been in a crowded area where we don't feel comfortable that we've been able to identify the contacts, we will reach out with a general request, for information for folks in those environments at that day and time to watch and monitor for symptoms. So again, we do want to encourage folks to, make sure that we are being respectful of others and being considerate of the different regulations and recommendations that are out there. Again, we know it can be tough and frustrating for folks, but it is important. We're all in this together. And, one of the things we are hearing, and we do know that if folks are non-compliant, we see, we're hearing of folks and they're just out and about and not adhering to the recommendations and guidelines. Unfortunately, these extreme mitigation techniques, social distancing, may linger longer. The more adherent we are and the better we do at following these guidelines, hopefully the quicker we can get out of this and get back to normal life as we do it. So again, just a couple recommendations there. Again, a lot of this is around community spread, and I've talked about this a little bit. We do have community spread in both Genesee and Orleans County, which means you can literally get it from anywhere, right? So it's not as important to know exactly where the person lives, so to speak, because we're all transient, we move around. And it's important to just monitor for symptoms and adhere to the 6-foot separation and the other social distancing recommendations that are out there. All right, so another real quick update that I have here, snowbirds. So we obviously have a lot of seniors that come back from different parts of the country this time of year. They get to go enjoy the warmth and get out of the Western New York winters. And someday, maybe I'll get there myself. But for now, I still enjoy the snow and cross-country skiing and snowshoeing. But the reality is these folks are coming back. And we do want to just reach out to them and make sure that we're giving them proper information that will protect them as they come back. Most of them are in one of our high-risk categories. So we do want to make sure that, that they're aware when they're coming back that the guidelines and the regulations here in New York may be different from where they're coming from. Again, New York, as we know, is the hardest hit state in the country. We have the most cases. And again, we're starting to see, again, continued increases in cases locally also. So it's important that, when these folks come back, that they're taking time to make sure that they're doing their best to self-isolate and quarantine within their homes, especially if they become symptomatic, that they're calling their healthcare provider. We're also, some may be concerned around prescription drugs and getting provision. So, again, if folks are coming back and you happen to be a neighbor or a family member, do your best to help those folks out, try to get them the supplies they need, and again, try to minimize their potential need to go out into the community. The more they can stay home during the next few weeks, particularly, the better, so that hopefully we can protect them and keep them from being exposed. So again, it's a community effort here, but we want to make sure that we're especially looking out and we're informing our seniors that may be coming back from different parts of the country. Also, this is a little bit of an odd reminder here, or a new thing I just want to talk about, but we have been getting some calls and reports around on-site sewage systems and public sewer in different areas. We all know that toilet paper has been at a basically non-existent really for the last couple of weeks, right? So there's a high demand for that. So we have been getting calls and concerns by people's systems not working well. And again, this is something that those in the country deal with regularly. We need to make sure that we're not flushing things that are not supposed to be going down the toilet, because it is causing problems, and this is one of those unintended consequences that people may be dealing with. So a little sidebar from on the health side, but just a reminder for folks, again, people are doing what they need to do, but just be mindful of what's going down into the system and into the plumbing in the houses. Because again, people are starting to experience some negative issues within their household because of that. As I'm going to wrap up and turn it over to Dan for his updates. But as always, these are difficult times, anxiety, concern that we're seeing. And we want to remind folks that there is behavioral and mental health available in both counties, 24/7. That is there for those folks that may be struggling or really have significant concerns about things. So we would encourage you to touch base with your local mental health provider or call the Care and Crisis Helpline. And again, that's available 24/7 at 585-283-5200 or by texting 741-741. So that's it for my brief updates here and situational update here in Genesee and Orleans County. So I'm going to turn it over to Dan Ireland to provide an update of what's going on at UOMFC and Acadia, and then we'll open it up for questions. Thank you.
Thank you, Paul. I appreciate the opportunity to join you today. And thank you to our legislative body, as well as the County Health Department and Genesee County's Office of Emergency Management, who've been very instrumental in helping us all respond to this situation and keeping all of our communities safe. Wanted to update the community related to actions United Memorial Medical Center and Rochester Regional Health have been taking to ensure that we are continually being prepared for patients who would come in either suspected of COVID-19 or positive for COVID-19. One of the asks from the governor earlier this week was for all hospitals across the state to expand its surge capacity by 50%, and ideally more than that. We hope we never have to execute on these plans, but we have made steps and prepared for them. And so through collaboration with our health system, with local county partners and our community partners, we did submit on Tuesday a surge capacity plan to the state government. This plan is based on 4 phases of implementation, and I'd like to quickly walk through them so people understand what will be happening here at our local hospital. Phase 1 was really to turn over and make available beds that we currently have through making more capacity in the hospital. And in doing that, phase 1, which was enacted on March 16th, did things like postponement of elective surgeries and non-essential services. This helped keep patients out of the hospital that did not have an emergent need. It also helped free up beds and spaces throughout the hospital that could then be converted or used to care for patients in the event of a surge of COVID-19 or other patients in the facility. That phase did a lot to free up existing medical beds that are already staffed, and we are confident that we have enough labor and equipment and supplies to accommodate those spaces in the facility. That essentially at our main campus takes us to a maximum capacity of about 79 patients for the acute care hospital beds, not including our ER space or any of our chemical dependency beds. Additionally, in phase 1, we implemented telehealth and phone and virtual visits. As Paul indicated, please call your healthcare provider prior to coming to any of the facilities. Get direction from them. They will direct you to alternative care sites based on your condition. And as a health system, Rochester Regional Health, including providers in our community, conducted over 500 virtual visits just yesterday alone. So it's working. People are calling, we're connecting them. Doctors in our community are using virtual visits either through My Care portal or through other venues such as the iPhone apps or other apps, Google apps out there that are on the list of eligible ways to look and talk to people. Additionally, starting last Wednesday, we opened up some additional drive-through evaluation sites at our North Street campus. Those sites included some flow changes for traffic around the main hospital. But what this has been able to do is patients seeking healthcare with symptoms that may be trying to seek the ER or being referred here by their primary care providers sometimes can receive their visit while never getting out of their car. Well, this actually really reduces the amount of patients that have to traverse into the hospital, keeps our providers protected, and reduces the potential for exposure. We've been averaging about 10 patients per day right now through those sites. The capacity is for much greater in the event that we need to take on more. And on average, we've been doing COVID-19 swabs of about 5 per day at the site. There is no guarantee if you go through that site that you're going to get a COVID-19 swab. You are evaluated by a healthcare provider, either a physician or advanced practice provider like PA or nurse practitioner, just like you would be evaluated if you came into the emergency room. They have also set up the capability to provide some treatments and care for you out there. So again, if we can avoid you getting out of your car and get you on your way with perhaps a prescription or perhaps just some good education on how to handle your symptoms, we're able to do that. And so we believe that's going to be a very successful way of minimizing the amount of impact on the inpatient side of the hospital. And in a few instances, patients who were evaluated further were brought into our emergency room if needed to be. So there's a mechanism for that as well. I just want to again say it is not a guarantee that you're going to get a coronavirus or COVID-19 test. This is for the evaluation of people who have symptoms and need to know whether or not they need further treatment. And that's how we're working on it. Primary care providers in our area have been encouraged to refer patients to that location, the tent sites at the North Street campus when necessary after evaluating the patient's symptoms. We've also begun the process of converting some of our non-traditional spaces to make them ready for clinical care. Spaces like areas in our operating room where we have pre-operative care. We're not doing elective surgeries now, so those spaces are available and can provide us a wonderful opportunity to house patients in the event we need that. We also know those spaces don't become active on a dime. They have to be pre-planned and staffed, and so that's the work that's happening today in our facility. And really working with both local and system-wide labor pools to ensure that our staff have cross-trained for the appropriate areas so when patients come in, they're cared for with the highest quality of care that you've come to expect. We are embarking now on phase 2. Phase 2 is turning overflow and other clinic spaces in to provide some additional patient care. And really, there's about 45 more beds that we will be able to activate in phase 2. This could including making some rooms semi-private rooms from private rooms, and as well as using rooms that previously maybe had been not utilized for patient care space, but were built and designed to be used for patient care space. So it'll take us about 7 days to be able to activate those spaces. So again, work is happening today on that so that we could spin up and make those spaces available if the volume increased and if we needed to do that. And then there's a phase 3 space that would really take truly non-traditional spaces and converting those. And that ranges anywhere from spaces that need to be built out and get certified by local and state officials to spaces that we might convert, such as other office spaces and places like that for patient care. The additional 89 beds that could come from that type of effort will take anywhere from 7 to 60 days to activate, depending on the space, and we're mapping those out now and doing the planning related to that. And then our health system as a whole is working with Monroe County and the other hospitals in the region to look at creating a regional field hospital capability. And that was covered today at the Monroe County press conference. And the Rochester Regional Health officials are actively involved in supporting that effort to determine if we need even more space beyond everything I've just outlined. We'll have a place for patients to receive care. So these really, those spaces and those plans are really the map we've been taking to fulfill the governor's requests and to keep our promise to provide local, high-quality healthcare in our organization. As far as supplies and equipment related to run all these spaces, that's a very fluid conversation. Depending on how the standards are evolving, and really, supply and demand can vary even by the hour. This is an area where locally our teams have been very supportive and helpful. I've been able to call Paul and Tim Yeager and say, do you have any of this type of a mask, or do you have any of this type of equipment? And I have to shout out a big thank you to them. The response is not like we'll get back to you in a little bit. It's we'll be there in 5 minutes with something to show you, or we'll put the order in and keep you posted. And it's been fantastic. We should be very proud of the support that we have locally for healthcare from our county partners. So overall, our community plays a huge role in this, as Paul's indicated. What happens in the future, this is not simply about capacity, but it's about the demand for beds. Please take social distancing seriously. Please stay home as much as possible. We really ask for your support and help. That is the only way for us to flatten the curve and the only way for us to ensure that we have enough hospital capacity for those that will truly need it, for the sickest of the sick, as we navigate the COVID-19 pandemic situation. Again, a final thank you to our teams and our families. Many of our clinicians come here and they serve our patients. As Paul indicated, we have had positive patients in the hospital. They're being cared for with, again, the highest quality of care, the isolation standards that have been set forth by the CDC and state government. And it will take our entire team to do this, and their families have been supporting them through that all that care. Our clinical teams, doctors, advanced practice professionals, nurses, aides, and techs, our admission registrars, human resource, supply chain facilities, all of food and environmental services folks have given 150% to this, and I cannot thank you enough for all of that. So be assured that UMMC is preparing to provide in every way that we can to our community, and really grateful to be able to be here to help support the needs that we have through this. Thank you, Paul, for the opportunity to be here today.
All right, thank you, Dan. Also, just to piggyback on that a little bit, I don't want to remiss and leave out Orleans Community Health. I've been in touch with Mark Sy frequently, almost every day, over at Orleans Community Health campus, specifically over in Medina, and I do know they're doing very similar things to what Dan articulated and what's going on at UMMC. Again, they've been working on the bed mandate expansion that the governor had, and also working on, again, shifting services and making sure that they're ready to respond in Orleans County, specifically to make sure that if anybody needs that level of care, that we'll have the bed space and capacity we need to help our residents. So with that being said, we'll open it up now for questions. I know we're pushing the clock, so I don't mind going a little bit longer, to answer some questions from the press.
Paul, this is Dan Fisher at WBGA. I don't know who wants to field this question, but both you and Dan have requested that the public exercises social distancing. You've made a point of that right along. I want to know if so, to what extent law enforcement is aware of this, and at what point will law enforcement see, let's say, a congregation of people and ask to break that up? Has that been done yet?
So I'll take this, Dan. Essentially at this point, again, we're asking people to be socially responsible and to do the right thing. The data's out there, the information's out there, the governor's directives are out there, and requesting, folks to, again, in certain congregate settings, be less than 50, less than 10. Obviously, we're not out policing gatherings on the corner of the street. We see them, we drive down the main streets, and there may be gatherings of folks. And again, like I said earlier, the goal here is for people to be socially responsible, adhere to the guidelines, and as I mentioned, the more we continue to congregate and not adhere and try to flatten that curve and slow it down by these extreme social distancing measures we have in place, the longer these things may be in effect. And I think the governor has spoken to that several times this past week, that we need to do our best, and that we know it's difficult, we know it's challenging, and it's not what people want to do, especially as the sun comes out and it's nicer. We want to get out and about and get back to normal life activity. So, we're asking folks to do their best, to do their part, and get us through this time period, sacrifice a little bit for the greater good of our community.
This is Howard Owens from the Batavian. I was waiting to see if anybody else wanted to jump in. I have several questions, if you don't mind. So first of all, Paul, I know it sounds like you've probably seen some of the social media comments. I'm getting a lot of feedback on this, and you've already addressed it, but I wanted to hone on it a little more. The governor today talked about how knowledge and information is comforting. What I'm seeing in the comments about people not knowing what town or city is really they're not feeling a comfort level. And I know you're saying it's a HIPAA issue, but it seems like a town or city name, village name even, is not personally identifiable information. And I think people would be more comfortable, even if it isn't totally necessary from a contact tracing standpoint or that whole aspect of it. Just it would give people more comfort. Do you think that policy could be changed?
Well, it's something that we continually discuss. We'll keep continuing looking at that going forward. Obviously, as cases increase and we get more data behind us as far as numbers, the small individual numbers are less vital, I suppose, when it comes to protecting. So that's fluid as we go forward. But again, I want to bring it back around to what you had mentioned and what I said earlier. The location of where the person resides is not what we need to be focusing on. We need to be focusing on doing our part to be separating from one another, focusing in on the community mitigation standards. We all travel. Any of our cases, the case contacting we've done, it's not the neighbors that live around these people that are the ones that we're putting under mandatory quarantine. It's folks, it's colleagues, it's people in different areas, it's people in other counties. Several of the folks that we have under mandatory quarantine aren't as a result of local positives. They're positives from neighboring counties, from other parts of the state. So there's a whole complex way that we look at case contacting, and I understand people want to know the location, the town, the street, the address where these people are living. But I'm telling you, I'm trying to articulate as best I can, that is not the relevant data that we need to really be focusing on. If there's a concern with the person, again, based on our case contact and where they've been, we are reaching out to those individuals and putting them under quarantine as warranted. If, again, as I mentioned earlier, if it's in a congregate setting and we don't feel comfortable with the potential exposure that may have been there, we will put out those type of releases asking for people to, potentially watch for symptoms if you were at X place at X time and day. So it is something we continue to monitor, and we may adjust that moving forward. But for now, we're going to stick with the quadrants, east, west, central, to relay positive cases.
Let's see. I can't unmute myself.
Other questions?
Kelly Stein. I just wanted to say a huge thank you to you, your staff, the watchful eye that you've been keeping on all of us together. And it is so important that we don't take these comments of social distancing as being frivolous. The opportunity for us to pay attention to this social distancing is so respectful for ourselves and the health and welfare of others. And an incredible thank you to our healthcare system that is holding us all up, keeping that fort built around us for our safety, our public safety, and our emergency management folks. We can't thank you enough. You truly are the heroes of the day. Thank you.
Thank you, Shelley. And as we've said many times, my staff obviously aren't up here with me, but they are in the trenches and working long hours and answering the phone calls and reaching out and doing these case contactings again to make sure the residents in our counties are protected and safe. So thank you. Other questions?
This is Howard again. I was having some trouble getting unmuted here. So you mentioned that none of the 7 positive cases are connected, and correct me if I'm wrong. But that almost sounds not very reassuring. That it would suggest that community spread is much wider spread than maybe some might assume.
Well, that's a fair statement. Yeah. So based on what we know through the investigations, they're not connected. Again, with as far back as we're looking, and your point is well taken. That's what we're trying to articulate. We have community spread. If you look around surrounding counties, they're reporting 20, 30, 50, 80 cases a day in Erie and the borough at some level. So, it is in our community. So again, we're going back to, let's not focus so much again on where these individual positives are and how many we have, but again, focusing on the bigger picture of social mitigation strategies. If you're sick, stay home. If you're feeling symptomatic, call your provider. Try to get swabbed. Again, we know that's a frustration for folks. It's a frustration for us with the continued lack of availability. But again, those are the strategies that are going to work. That's what's going to get us through this time period is social distancing and making sure we're adhering to those guidelines.
This is Howard again. I want to read a question from Tom Rivers. He says he can't get unmuted. I have more, but he says he has in chat. He's saying hand sanitizer and Clorox wipes are also hard to come by. Could those be made available to the public, perhaps through the inmate crews at Albion Correctional?
I don't know if we have anybody from EMO on, Tim or Dale. I mean, from what I understand of that process now, they're still continuing to produce more of that. The original shipments that went out were geared towards municipalities, first responders, different healthcare agencies. And my understanding was at some point, if the capacity gets to the level that it's available for more widespread distribution, that will happen. But again, that was my original understanding. So hopefully at some point, again, if the capacity and the availability of it gets to the point where we can distribute that in the community.
And Paul, it was also revealed to us today by Tim Yeager that right now, that even the delivery they took today or yesterday was only 1/3 of what they ordered. So even that, supply chain delivered by the National Guard was not what was expected and or what we know is trying to meet some of that capacity. And that's a day-to-day situation.
Yeah, thanks, Jay. Yep.
So, Paul, as I exchanged an email with you about this briefly. I reported the other day that the federal facility here for the immigration court, they may have had some positive cases there. That's outside of your jurisdiction. We also have the VA hospital here that I imagine is outside of your jurisdiction, possibly the state Veterans Hospital. And I'm wondering if there are cases there, do you get notified of that? Does that get part of your contract tracing? And related to the contract tracing, because this gets on something you said earlier, if there's a case, say, in Monroe County and they identify somebody in Genesee County, do you get notified of that to put that person on mandatory quarantine? Just discuss how those other jurisdictions play together to help you with contract tracing and putting people in quarantine.
Absolutely. So we do get notified of positives, and again, it's based on county of residency. So we have a lot of folks that work in our prison systems, that work in for the Federal Detention Center, these other locations that don't necessarily live in Genesee or Orleans County. So we may not get those positive results back to us through our reporting system. They're going to go through the residency of county. So again, you may hear of a case or a suspect case potentially in one of these facilities, but that does not mean that they live there. So what happens is the local health department where they reside actually starts that case contacting. They go backwards to the onset of symptoms, and if they were at work while symptomatic, they would notify us potentially as the local county, and then we would be working with the employer to identify those contacts within those different facilities. So again, it's a very collaborative approach. We have very good working relationships with all of our surrounding counties. Again, we've had folks where our positives have been in contact with people from other counties, and we essentially hand those off for the investigation at that point, and those counties place their folks under mandatory quarantine and monitor them where they're at. So it's a collaborative effort, and we do work hand in hand to identify those close contacts and make sure that we're protecting them and protecting our community.
So when we see your count of mandatory contacts, that some of those people could be people that were in close contact with somebody in another jurisdiction, and you got notified of it, correct?
That is correct.
I want to ask a question about masks, and Dan may want to jump in on this too, or somebody else. I've been contacted by a couple of people wanting to do volunteer efforts to make masks. Now we know if they're not N95 masks, they're not as effective. But what I'm reading in some other countries, some other jurisdictions where mask use is widely practiced, they are not getting the same level of community spread potentially. So I'm wondering if just the more cover masks, maybe we should have those more in wide use, and would it be useful for volunteers to do that? And my part two of that question on N95 masks, I know that Wyoming County, I'm getting their press releases, they've asked community people to come forward with N95 masks and make them available for healthcare workers. Any consideration to doing that kind of thing here? Because it seems like they're having some success.
I'll comment quickly, and Dan or any other can comment. So we got to be careful with masks. We do know that they're barriers, and having a mask on or any barrier is better than none. But when we talk about N95 masks, we got to keep in mind for them to be properly utilized, they have to be the person has to be fit tested. The mask actually has to have a nice seal around the mouth and the nose area to make sure that there's no leakage or any type of potential, side breaks, etc. So folks in the healthcare setting, our health departments, first responders, they're fit tested to make sure that that mask is sufficient and then providing proper protection, especially when they're dealing with someone that's symptomatic and also someone that may be COVID-19 positive. So we got to be careful when we make recommendations. Again, people wearing them around, it is a barrier. But our biggest concern, and the reason it's not widespread, everybody wear a mask, is there's continuing to be a shortage of them. If you look, again, we're looking for masks. Our healthcare workers are looking for masks. Again, Jay just mentioned the pallets and the shipments that we're getting in that we've been ordering for weeks now through our emergency management offices are not coming in with the level of PPE we're looking for. So, the recommendation is still not to be walking around and wearing masks. The recommendation is stay home, self-mitigate, keep 6 foot away from people, and the mask and wearing them is not going to be as vital.
I'll make this my last question, and this is for Dan. Dan, so we've heard that there are 3 people hospitalized. That doesn't necessarily mean that they're hospitalized at UMMC. Are you able to say how many people are at UMMC? And then a follow-up question to that is, I've never really gotten a kind of account of what is your capacity? How many patients can you handle at one time who are being treated for COVID-19, and kind of what's your expanded surge capacity on top of that?
Yep, sure thing, Howard. I just want to finish one comment related to the mask. I agree wholeheartedly with Paul. And we have had an outpouring of people contacting the hospital, offering up masks, and some of them have been medical grade, coming from doctors' offices and other health facilities that are not operational now. So a big thank you to all of them, both surgical masks and N95 masks. Paul is correct. N95s, we do have to go through a process of fit testing. We've actually increased our fit testing team capacity here. So as we run out of one type of mask, we would be able to fit test for a different type if that's what we can get in the supply. But it's complex, and it's definitely something that it takes some nuance to it, making sure that we put the masks in the right place. We are wholeheartedly following the CDC and New York State guidelines on when to use masks in our hospital and at what locations. And some of those guidelines actually, when followed, help preserve some of the masks so we can use them for a long, have more masks for a longer period of time. So that's definitely been helpful to follow those. As we've said with everything else, it's changing day by day. So some of the donations of masks that we've received that maybe don't fit the bill right now, as shortages continue, and if we may reach a point where we may want to go ahead and use those, and we have professionals evaluating that both throughout the health system, people whose job is to understand the nuance of using a particular type of mask for a procedure. So, but again, the community has really been stepping up to offer their services, and we appreciate that. And we've been, keeping track of people who've been asking and offering. And if the time comes, we will definitely reach out to them. With respect to capacity, actually, given the current guidelines, almost every one of our medical surgical beds and ICU beds can handle a COVID-19 positive patient. The guidelines today for a patient who's not experiencing an aerosol generating procedure, and that's a term that's really cropping up out here, but certain procedures cause the patients to cough more and to expel aerosol, which is what we believe is one of the main transmission sources. Those procedures have to be done in very specific rooms. We call them negative pressure rooms. And so there's always a limited number of those in the hospital at a normal state. But for those not experiencing that aerosol generating, they can go in almost every patient room. So again, our capacity currently for general operations and staff has been about 79 beds, which includes our OB beds. So again, we wouldn't fill every one of those OB beds. We would keep those reserved for maternity patients. There's about 10 of them there, but about 79 beds that we could fill. And then, as I outlined earlier with the surge numbers, in phase 2 of the surge, we could add, in phase 1, using up spaces that were previously used, we could bump that up to a total of about 96 beds. And in phase 2, we could add an additional 45 beds to that to account for that surge. And then phase 3, which is really much more extreme, we could go up to 89 beds. Additionally, we have added more of that negative pressure capability, so we could take more aerosol generating patients that need that. Normally have about 5 of those on our inpatient units and 2 more in the ER, and we've been able to up that to 12 now, and could go as high as 15 with our current supply of equipment. It is a moving target, because as we can get more negative pressure fans with the filters on them, we can convert rooms as we need to. But really, the guidelines have not needed us to create all that many more negative pressure rooms. It's really having the PPE to wear in the regular rooms for these patients. I hope that answered your question, Howard.
That's good, Dan. And it suggests a follow-up. Are you able to say how many ventilators you have, and do you have any on order? Do you expect more? What's that status?
Yes, currently our normal stock of ventilators, and there's 2 types to talk about. There's 7 regular ventilators, they're called closed circuit ventilators, and then there's 10 non-invasive ventilators. Both have a role in treating a COVID-19 patient. The 10 you would try to use on a lesser acute patient, but the 7 would definitely do that. We have also added 2 additional ones that we borrowed from another facility to have on our stock. And are working with local health agencies that might have ventilators that we'd be able to take in as well, to up that, potentially having another 5 or 6 of those to be able to come in. But today, right now, on hand, I have borrowed the 2 that I mentioned. We have 9 total in stock. We also have the capability, with some adjustment, of using anesthesia machines as ventilators, and we have 9 of those in the building as well. We would always keep a couple of those for emergent surgeries, but ultimately we estimate between 5 and 7 of those anesthesia machines could be repurposed if we had a surge on ventilators. So that, again, is a moving target, because as we can continue to get our hands on supplies of ventilators, we are getting them and getting them in stock and ready to go if needed. Right now, I would say that our average use of ventilators has been between 1 and 3 a day, not COVID-19 related necessarily, but for just average patients with medical problems. We've been using some, but we have some more on standby.
That's great to hear, and let's hope we don't need them.
We agree.
Okay. Paul, I just have 2 quick questions. It's Tom Rivers. I think I'm unmuted or muted or whatever.
Go ahead, Tom. I can hear you.
Yeah, well, with the state prisons, we have the 2, and it's about 1,000 inmates each. If I just understand right, if an inmate tested positive, that would count for the county. But if it was an employee and they didn't live in the county, I guess that wouldn't count for us. With the way the system.
Yeah, we would not have that count within our numbers, so to speak. It'd be whatever county the corrections officer resides in.
And if there was a positive in the prison, would that be highlighted in a special way? Do you know what I mean? Or would that just be a central Orleans case?
Yeah, it would just count as a general case. Again, we wouldn't be highlighting or identifying those type of things. Because, again, on the back end, it doesn't matter from our perspective on the case contacting side.
Okay. Well, I guess this is a question maybe more for Jay. I'm guessing the counties are somehow tracking their expenses, and maybe this federal stimulus will reimburse the counties? Okay, or maybe for Lynn. I guess Lynn's there.
Is there Kristen or Jay or Shelley? Any of you can speak on that.
I can speak on that, Tom. We have a special account number in our appropriations that identifies COVID-19 purchases, so that our treasurer can identify everything that is purchased specific to COVID-19. And that way, our emergency manager can also put that through for FEMA purchases.
Okay, and is that 100% reimbursable?
At this point, that is what we are told.
Okay.
Genesee County is basically doing the same thing, both from personnel standpoint and procurement of equipment. Understand anything that comes out as far as FEMA is concerned will follow whatever their current percentage guidelines are, and also what the standards are, if anything, as far as reimbursement of the C-19 incident versus anything up until there was a federal declaration for C-19, because typically FEMA has been 75-25.
Okay. Well, thank you.
Okay, well, we're pushing well past the time we had allotted for this, so I'm going to wrap this up. Again, if you have additional questions that you want to follow up with, please contact our PIOs. The media, you all have those contact numbers. And again, we just want to remind folks to be safe out there, adhere to the guidelines, and be well. So we'll be in touch soon. Thanks.
Thank you, Paul. Thanks you.